Hello, my name is Kevin. I'm the pharmacy intern and I wanted to review a patient's medications with you. DM is a 42-year-old male who presented to the clinic today for a reading of his MAN2 tuberculosis test. After reading the test, he showed an induction of 15 millimeters in diameter, which indicates a positive test. The patient denies any fever, dyspnea, hematitis, or cough, and a physical exam was unremarkable. The patient does have a history of seizures and alcohol consumption. He currently takes carbamazepine 300 milligrams extended release, 2 tablets by mouth twice daily, and he reports no recent seizures. Patient also reports taking acetaminophen 325 milligram tablets and calcium carbonate 500 milligram tablets over the counter. The medical team prescribed DM isoniazid 300 milligram tablets to be taken by mouth once daily for 9 months, and this is for treatment of his tuberculosis. This is the preferred treatment for tuberculosis, but it will likely interact with the patient's carbamazepine treatment. The interaction will consist of inhibiting the metabolism of carbamazepine, increasing its serum concentrations. The carbamazepine has been effective in controlling the patient's seizures, therefore we won't want to take him off the carbamazepine, so we'll have to get a baseline reading of the patient's carbamazepine serum concentrations, monitor any changes in the serum concentrations after initiation of isoniazid, and appropriately reduce the dose of carbamazepine to avoid toxicity. Normal carbamazepine ranges are typically between 4 and 12 milligrams per liter. Common signs of carbamazepine toxicity include nausea, vomiting, sedation, and blurry vision. Using the isoniazid and carbamazepine together increases the risk of hepatotoxicity, and then adding in the acetaminophen and alcohol, the patient is at even higher risk for hepatotoxicity. Common signs of hepatotoxicity include jaundice, dark urine, and upper right quadrant abdominal pain. If the patient notices any of these symptoms, he should immediately report them to his doctor. To reduce the risk of hepatotoxicity, I would recommend the patient discontinues the use of his acetaminophen and replace any over-the-counter as-needed medications with NSAIDs such as ibuprofen for pain. Ibuprofen is available over the counter as 200 milligram tablets, and the patient could take 1 to 2 tablets by mouth every 4 to 6 hours as needed for pain. Counsel the patient not to exceed 3,200 milligrams of ibuprofen per day, and that the medication should be taken with food to avoid any GI upset or bleeds. The patient should also be counseled on the importance of avoiding alcohol while taking hepatotoxic drugs. The patient should be informed that the calcium carbonate can decrease absorption of isoniazid and should be held until at least 1 hour after taking isoniazid. Isoniazid should also be taken on an empty stomach, so no food 1 hour before or food 2 hours after taking the dose for isoniazid. If you have any questions, please feel free to contact me here at the pharmacy.